Medicare Part C is the Medicare Advantage program, and if you decide to go that route as opposed to original Medicare with a Medigap plan, you'll want to know how to enroll in Part C, or in other words, how to sign up for Medicare Advantage. Unlike Parts A and B, which you sign up for through the Social Security office, Part C is optional, so the way you enroll in Part C is to find a suitable Medicare Advantage plan that is offered in your county and enroll in that coverage. To qualify for a Part C Medicare Advantage plan, you must first be enrolled in Medicare Parts A and B. You must also live in the plan service area and enroll during a valid election period, such as your initial enrollment period for Medicare or the annual election period that happens each year in the fall. There are usually dozens of different Medicare Advantage plans in most urban counties, and they all have different features and they may work differently depending on whether their network is an HMO or a PPO. It's important to make sure that your doctors are in the plan's network and that your medications are on the plan's formulary before you enroll. So if you are new to learning about Part C, you'll want to check out our other videos here on YouTube about Medicare Advantage plans, such as our video on the pros and cons of Medicare Advantage plans. But assuming you've already done your research and compared the various Medicare health plans available in your area, and you found one that you wish to join, you can sign up for your Part C plan in 3 different ways. Medicare has a hotline, 1-800-MEDICARE, and as a beneficiary, you could call that hotline with questions and/or to sign up for a Medicare Advantage plan. The representative will walk you through the enrollment process. You could also register for a free account at mymedicare.gov, and inside your portal there, you will find the Medicare Plan Finder. You can use it to review the different Medicare Advantage plans that are offered in your county, and you can sign up for one of them online during your initial enrollment period. While enrolling in your plan through Medicare is free, you'll want to be aware that this leaves you with no agent to represent you on the back end. The help of an agent like us here at Boomer Benefits is also free, and it provides the added benefit of free claim support for the life of your policy. You'll know exactly where to call for help if a claim gets denied or your medication requires an exception. You'll have someone on your side when it comes to Medicare, and you'll also never be alone in dealing with any back-end Medicare issues, which are quite common. A second option for how to enroll in Part C is by signing up directly through the plan itself. Most insurance companies who offer Medicare Advantage plans have websites where you can find the contact information for the plan. You can call directly to the plan to sign up, or you can join online if they offer that option via their website. Some people prefer a paper application, so you could also request an information packet and the application will be mailed to you by the plan. A word of caution here, Medicare plans are not allowed to make outbound calls to enroll you into a plan unless you ask to be called. So never provide your personal information to a plan unless you contacted them at their enrollment line and asked them to initiate an enrollment. Enrolling through the carrier's website or hotline, though, still leaves you without an agent for any of the things that can go wrong on the back end. Your last option is to sign up for coverage through a trusted independent broker who specializes in Medicare plans, and of course, who better than us here at Boomer Benefits. Our service is always free to you. We are compensated by the insurance company that you ultimately choose to enroll in. But we provide something you will find nowhere else. Keep listening. We can help you compare the various plans that we represent in your area, and we can find one that is suitable for you to enroll in. That means we do all the legwork to verify that your doctors are in the plan's network and your important medications are covered by the plan's formulary. When you sign up for your plan through us, there are no added fees or charges. You will pay exactly the same premium for your plan as if you had signed up through Medicare or the plan itself. Many Advantage plans these days have 0 premiums, and we can help you enroll in those plans too. When you enroll in a Medicare Advantage plan, Medicare compensates that plan for taking you on as a member. The benefit then to signing up through us here at Boomer Benefits is our legendary client service team. We have over 15,000 5-star reviews online, and that's because once you enroll through us, you have the full support of our experienced service team when you run into any issues. So if you receive a bill in the mail that you weren't expecting, you call us and we'll research it to see whether your plan should have covered it or whether it's a valid copay required of you by the plan. If a pharmacist says he can't give you a medication because your plan has applied step therapy, you probably won't even know what that means, but it doesn't matter because you'll call us and we'll walk you through all of your options. If you need an important diagnostic test or procedure and your plan is dragging its feet on the prior authorizations, you can call our service team and we'll conference call together to your plan to see what the holdup is and is there anything we can do to help move things along. These are the kind of services that you probably didn't even know that you needed yet, but they are the reason why tens of thousands of Medicare beneficiaries stick with us year after year, because we will be here for you when it counts. You can learn more about our client service team here on YouTube, and if you haven't yet decided whether you want a Part C plan or a Medigap plan, check out our video on your one-time open enrollment period for Medigap, because if you decide to go the Medigap route, it's the most important enrollment period that you don't want to miss.